The goal of this video lecture is to review some of the behavioral symptoms of eating disorders and define the behaviors that will be used in reviewing the diagnostic criteria that distinguish the different eating disorders from one another. One behavioral symptom of eating disorders is restriction of food intake. So an individual who's restricting their food intake is taking in inadequate energy or calories relative to their physical needs. So in order to maintain their body weight and their activity level, or in order to grow at an appropriate developmental pace, the individual has a certain level of energy or caloric needs, and they are refusing to ingest sufficient calories or sufficient energy in order to meet their caloric and nutritional needs. And this restriction of food intake results either in weight loss or in a failure to gain weight appropriately. So in adults, it's typical for food restriction to result in weight loss, which may result in a low weight or a low BMI. Or if we're looking at children and adolescents, it may be a failure to make expected weight gains. So for example, you may have a child who developmentally has typically been in the 50th percentile for weight consistently over time, who isn't losing any weight, but who, because they are not gaining weight, is in a lower percentile. So they may go down to the 40th or the 30th or the 20th percentile. So this is a restriction of food intake that results in caloric and energy intake that's insufficient for the individual's energy needs, and either results in weight loss or a failure to make appropriate weight gains. Another behavioral symptom of eating disorders that we can observe is binge eating. And the DSM has a very specific definition of what constitutes an episode of binge eating. So in the DSM, an episode is considered binge eating when the individual eats in a discrete period of time an amount of food that is definitely more than most people would eat during a similar period of time and under similar circumstances. And importantly, the individual has a sense of lack of control over their eating during the episode of binge eating. So this definition includes several important components. The first is that this is a discrete period of time. So this is not a long-term issue with overeating. This is not chronic over days or weeks or years. This is a distinct episode of eating. So the DSM suggests that a 2-hour period would constitute a discrete episode, although obviously the exact time may vary depending on the individual and the circumstances. So there's a discrete time period. There's also the quantity or the amount of food. So it's a large amount of food, and objectively it's a greater amount of food than most people would eat in a similar amount of time and under similar circumstances. So for example, eating a very large meal at Thanksgiving dinner does not count as an episode of binge eating according to the DSM, because it is socioculturally normative to eat a large amount of food in that context. Similarly, an individual who is carb loading for a marathon and eating a large amount of pasta would not be considered an episode of binge eating, or even a person who is deliberately engaging in an eating competition and eating a very large amount of food. These would not qualify as an episode of binge eating because, given the circumstances, other individuals might eat a similar amount of food in those circumstances. And the last important part is that the individual feels that they're not able to control their eating during the episode. So they haven't deliberately decided to eat this very large amount of food, but in a discrete amount of time, they're eating an objectively large amount of food, and they feel that the eating behavior is out of control. So all of those conditions are necessary for an episode of eating to be considered binge eating according to the DSM. And then our final behavioral symptom of eating disorders are what are referred to as compensatory behaviors. So these are behaviors that an individual engages in order to prevent weight gain. So these may be compensatory behaviors that an individual engages in response to an episode of binge eating, but it's not necessary for a person to have engaged in binge eating in order to engage in compensatory behaviors. So for example, there is a binge purge subtype of anorexia nervosa where often individuals are not engaging in episodes of binge eating that meet the DSM criteria for an episode of binge eating, but they are engaging in compensatory behaviors in order to prevent weight gain when they do eat food, even if the food that they're eating is not sufficient to constitute an episode of binge eating. And typically we divide compensatory behaviors into two subtypes. So the first is the purging subtype of compensatory behaviors. So these are behaviors that are designed to purge food that has been consumed in the hopes of preventing weight gain by stopping the body from absorbing calories or energy from that food. So purging behaviors might include behaviors such as self-induced vomiting or misuse of laxatives or diuretics to address concerns about weight gain related to food or liquid intake. There are also a range of non-purging compensatory behaviors that individuals engage in order to prevent weight gain. So this might include behaviors such as the misuse of medication. These are medications other than laxatives or diuretics, so these might be things like diet pills or ADHD medication or stimulants that an individual is using as compensatory behaviors to prevent weight gain. So for example, if an individual has engaged in binge eating, they might take diet pills afterwards so that they can restrict their food intake because they're worried about gaining weight. Fasting can also be a compensatory behavior. So if an individual engages in fasting behaviors, if they skip meals or stop eating for a day due to concerns about weight gain after eating food, that would be considered a compensatory behavior. And another common non-purging compensatory behavior is excessive exercise. So an individual who's engaging in exercise specifically in response to eating in order to prevent weight gain. So both the purging and non-purging compensatory behaviors are behaviors that an individual engages in after eating in order to prevent weight gain, particularly when an individual has engaged in episodes of binge eating and is concerned about the potential consequences of that binge eating. So again, that's not required for compensatory behaviors, but that is one characteristic way that we sometimes see individuals engaging in these compensatory behaviors.